Okay, so looking at drug testing in sport, we're going to kind of examine some of the important points that go into a drug testing policy. Obviously, when we're looking particularly at the NCAA, the World Anti-Doping Agency have very well established, and obviously, again, professional sports all have established drug testing protocols that they utilize. What we're going to do is talk about what goes into both a drug testing and drug prevention program. Again, the idea when we're talking about a drug testing program, in reality, we're looking at it as a drug education program, again, to kind of ensure the, not only just the, how important it is to make sure that nobody's getting any legal edge in sports, but also looking at, being able to educate athletes on what to avoid due to potential harmful effects that a lot of drugs can have. So we'll look at kind of what goes into that and kind of talk about the logistics. Some individual institutions in college sports also have their own drug testing policies, and we'll talk about some of the legal aspects associated with that. So as far as drug education goes, and again, that's kind of the overarching goal. Your book talks about that, like regardless the level of sport, what we're really trying to do is educate athletes on, the importance of understanding, the issues associated around drugs. So for just for health purposes. So that's an important thing to look at. So when we kind of look at a comprehensive drug prevention program, and these are kind of guidelines that the NCAA suggests that you have kind of in place. And again, the athletic trainer along with the team physician within the sports medicine department at an institution or at any university will have this. So again, make sure to have a written policy with the athlete's consent before drug testing starts. Again, that kind of looks at like a lot of the legal issues surrounding drug testing. Again, define banned substances and the consequences of a positive test. Make sure to kind of look in your book the various drug classes and kind of what falls into them. There is a table in the chapter that goes over, select drugs that get mentioned throughout the chapter. So kind of just be aware of them. That's kind of an important thing to sort of look at. Again, they're not necessarily all illegal drugs, but they are drugs that you do have to, again, be aware of and be able to recognize. So, make sure to note that. Again, review institutional and conference rules. So again, whatever conference you're participating in, and make sure that it's consistent with the university. Always make sure to do an annual review, and this is kind of something you want to do with all your policies, not just this if your institution has a drug testing program, but just in general, it's always a good idea to review policies. And again, define punishments for a positive drug test. So if there are ramifications to that, make sure that athletes are fully aware of that. So again, a typical program does include education and rehabilitation. So again, part of this, again, and this is testing is an important thing to deter use, but again, the big thing is education. While we say that there's punishment for positive drug tests, again, you're not looking at this to be necessarily a big punitive thing per se, but obviously we want to make sure that athletes are safe. They're not using substances that could potentially cause them harm. And again, make sure to have educational resources available just to make sure that athletes don't realize maybe they are taking something or that's a supplement. Make sure that they're well aware as far as like what can possibly have a test. We did talk a little bit in the supplements chapter about kind of what to look out for, but again, educational resources are going to be very important for athletes to make sure that they don't even just do something by or take something by accident. So just kind of looking at some history that I think is relevant to kind of look at to see how this kind of evolved. So again, when we looked at going back as far as 1960, we started to look at performance enhancing drug testing as in cycling and track and field. There's a historical thing noted that there was an Olympic cyclist that died after collapsing during a race, and an autopsy had revealed that the individual had taken amphetamine. So that's when kind of the this sort of started to take place, and again, more for the safety of the athlete. It wasn't so much that we were worried about people cheating per se, but again, it's the safety of the athlete, because there you had a situation where an athlete unfortunately passed away. Intercollegiate testing kind of came in around the mid 1980s, and athletic trainers were kind of perceived as kind of like the first line, which is probably apropos given what we're, kind of how we operate within an institution and in the sports medicine program. And again, you kind of saw the growth in drug testing, and many institutions even have some form of a testing program, and that's kind of grown a little bit. So that would kind of be an important thing to look at, and kind of weigh the pros and cons of if your individual institution will have a drug testing program. So that started to grow. Now, what became a concern, and these are some highlights of the NATA board of directors. So they started to look at this and realizing this became a much more prominent practice for these institutions to have individual drug testing programs than the athletic trainer. So obviously the NATA kind of looked at it and had some concerns. So again, one is that there could be some perceptions of discrimination, particularly with which athletes were getting tested. Could there be a conflict of interest, related to a lot of this that could end up compromising the athlete's health and well-being? That was something that has come up as well. Again, has the institution's medical and legal reps approved the program? And this should be something that if your athletics department, say you go somewhere and they don't have their own individual drug testing program, if they are going to do it, make sure to have legal representation. So that was something that was kind of pointed out by the NATA. Is there a role in the AT in imposing or enforcing sanctions for a positive test? And there was concern there by the NATA that, are we putting the athletic trainer in kind of a bad spot regarding that? Again, maintaining confidentiality, which is very important, as it is with anything. And then the question at the time, when this kind of became, and this was back in 1984 when the NATA was kind of looking at this, the concern was, is the AT qualified to assess the needs of an athlete with a substance problem? Again, really the take home of any drug testing program related to athletics is, again, it's for the education and safety of the athlete. And if an athlete particularly has a problem with abusing, an illegal substance, for instance, is getting them help. And is the AT qualified? We do know now that, as athletic training education has evolved, they're definitely within your education, as you've probably even seen, there's, at least a basic kind of screening process that an athletic trainer is made aware of. Again, the athletic trainer can't treat somebody with a substance abuse problem, but can it be recognized? Now we look at that and say yes, but at that time, it was a bit more of a concern because the education at the time didn't really go in depth with it. But as athletic training education has evolved, we have definitely more awareness of different types of screens and stuff that can be utilized to recognize this. Then we look at the world, and we talked a lot about the World Anti-Doping Agency already, and the U.S. Anti-Doping Agency. So again, the World Anti-Doping Agency was organized by the International Olympic Committee in 1999, and then in 2004, kind of developed standards. And again, the standards just kind of relate to all that we see up here. Basically a lot of the procedures regarding testing, the laboratories, therapeutic use exemptions. So that's something to always be aware of. We kind of talked about that a little bit, regarding, when someone does, if someone does take a medication that does contain a banned substance, and how that kind of gets, what has to take place for that. And that's something to always look at. And then, the USADA, or the United States Anti-Doping Agency, they basically signed on to the code, and these particular standards have been used by both the NCAA and various, professional team sports. So, and again, that's been kind of carried over into that. And again, here we look at, again, substances that are banned all year round, substances that are banned for particular sports, and various individual institutions and professional sports leagues, partner with with drug-free sport to work on, again, working with athletes for their safety. So again, this kind of, the comprehensive approach looks at who is to be tested, how the specimen is going to be collected, and where the specimen is shipped. So we have these two organizations that have kind of, worked with each other to kind of develop this procedure, and to really make sure that the process is very stringent, to make sure that it's followed appropriately. So one of the things that always kind of comes up are a lot of the legal questions, and a lot of this has actually been vetted already. Your textbook talks about some different court cases that have taken place, and for the most part, it's all gone in favor of the drug testing. So, a lot of people have challenged that. It hasn't worked out. However, the athlete does have to give consent to being tested. So, like I said, a lot of these programs have gone through legal challenges throughout the years. I'm not so much concerned that memorize all dates, but it's good to have kind of context for that. So professional athletes give consent in collective bargaining agreements. So basically, for them to participate, they have to do that. And in NCAA, so essentially to play an NCAA sport, you have to grant consent. If you don't, that results in ineligibility. So, and again, that's something that's past court cases. If you're gonna, if according to NCAA regulations, every student athlete is going to be mandated to give annual consent, and if you don't, you are declared ineligible. So, and again, that's all past all the sort of legal challenges that's been faced. So, both at the professional and at the NCAA level, you do have that taken into place. And as far as the responsibility of the sports participant, they alone are responsible for all the drugs they take and anything that they ingest. So whether it's supplements, medications, they have to disclose all that and make sure that everything is all right. If they have questions, they need to check to make sure. Again, as we talked about, FDA safety standards don't apply to nutritional supplements. So you need to make sure that, if they are taking a supplement, they're well aware of what they're taking. We had talked about the NSF certification, which is very, important to look for when you're taking any type of supplement. So they must use caution. Again, supplement companies are not under the same strict standards. Athletes have had positive drug tests when they didn't even realize they were taking anything because they were taking a supplement that they didn't think had anything in it. There's resources available. Again, the National Center for Drug-Free Sports. So there are various things available for athletes to utilize. And again, you need to make sure that they are made aware of that. Again, make sure to also look, and we'll talk about these maybe a little bit later as well, but they're the categories of banned substances. So table 21.1 in your text is an important table to look at. It kind of breaks down all the categories of banned substances and common examples. So those would be things that you would want to be made aware of as well. So whether again, add extra notes to make note of that, or just make sure to go back and look at them. But please give them some due time and attention, because those are going to be important for testing purposes. So supplements are always a big thing with this. Again, as I had said on the last slide, be aware of all the different categories of banned substances. So at least have a general idea of those. The NSF International is a really important program. Again, they're a banned substances certification program, so they will certify the accuracy of product ingredients. So if someone is taking a supplement and that's on there, they are certifying the product and that it does not contain banned substances. And typically that analysis is accepted by many organizations. So that's something that if they are taking that, now it doesn't necessarily mean that if a supplement does not contain NSF certification that they can't take it. It's just that, again, there is obviously a risk with that. So again, athletes need to be aware of that. Another resource is the Drug-Free Sports Access Program. This is an online portal that's available to athletes and administrators through a subscription service. So an athletic trainer can actually forward information regarding a specific supplement or drug to the Access portal, and they will, within a few days, give a reply and give information back on the product. So again, this is a good resource for evaluating the ingredients of a product. And again, it's an ideal, it's a really good thing for risk assessment, so that they can give accurate feedback on supplements, and again, to make sure. Now, again, Drug-Free Sport does regularly acknowledge that there's information on medications or supplements that don't always guarantee that they're safe. But again, there's always a risk of an unreported banned substance. But these programs are definitely things that can definitely assist in education again. And you also always need to be aware of prescription medications. Athletes should always, in their medical history, be disclosing all medications that they're on, to make sure. And if there are things that need therapeutic exemptions, it's very important to have all that paperwork on file. So looking at the drug testing process, so when we're looking at this, so basically your institution schedules with Drug-Free Sport. So typically a drug testing session can be scheduled with Drug-Free Sport by the institution or whatever the governing body is during the athlete's competitive season or in the off season. And what will basically happen is, Drug-Free Sport will provide names, the institution will contact the athletes, and again, it's going to be done, the testing will be done at random. They will send, Drug-Free Sport actually sends an expert team for testing. So they basically, the doping control officer will be in charge of, Drug-Free Sport will assign somebody to that. And again, they'll do the screening, which can be at a college campus. It can be either at a college campus, an event, or even at the athlete's home. And again, they identify the approved labs to make sure that there's consistency and accuracy with the analysis. And again, many institutions will kind of follow that same template or policy if they're going to have their own drug testing program. Again, Drug-Free Sport is unbiased and free of conflicts of interest within the institution. So, again, all their testing will be done at random. And again, unless an athlete requires a follow-up test. So if an athlete does require a follow-up test, then obviously that particular test won't be random. But again, many institutions will follow a very similar policy, which again is good. If an institution is going to have their own drug testing process and policies, it's probably good to just use a firmly established one. Now, when we look at testing is generally going to be through urinalysis. And, I do want you to be aware of general detection time. So, again, for the most part, urine specimens are very simple to obtain. They're cost effective. It's a little awkward because you do need a witness present during urine collection, which is considered to be a little intrusive, but you need to make sure you have that. There's also other ways to test. You can test through blood, hair, saliva, sweat, have also been used in various settings. Again, there's advantages and disadvantages of that. They compare different types of drug testing techniques. So table 21.3 talks about the different drug testing techniques, and then they have the table 21.2 has the urine toxicology times for different types of banned drugs. So we'll talk a little bit about those there. So amphetamine, methamphetamine, usually around 2 to 4 days are the typical urine duration times. Cocaine, 1 to 3 days. Cannabis, 1 to 3 days if they're a casual user. It can be up to 30 days in a chronic user. So someone who does basically, chronically uses cannabis, it could go up to 30 days. If someone just kind of has daily use for a period of time, it could be 5 to 10 days. But that's what you look at with cannabis. With opioids, anywhere from 2 to 4 days. Anabolic steroids, the urine detection times are usually around 3 to 4 days when we're looking at that. So those are some of the different types of things that we look at as far as like time frames with various types of substances that are typically banned and need to be detected. Some other things to look at from the athletic trainer's responsibility. So there's a couple things that the athletic trainer will be responsible for. So the athletic trainer will secure the marshaling location, the necessary restrooms that are going to be needed. So when drug-free sport comes to the facility, the athletic trainer will be responsible for that. During the process, the athletic trainer will provide like water and sports beverages to facilitate urination, particularly for dehydrated athletes. And so that could be something, and also snacks may also be provided in case the urine's too dilute. The doping control officer is actually going to be the one responsible for accompanying the athlete to the restroom. So they're the individuals that will be there and to witness that. And then the AT will also serve as the representative for the team or the institution and just be aware of any documentation issues and troubleshoot some problems with that. Occasionally, if an athlete does have a trouble getting a specimen, we'll talk about that on the next slide. The whole concept of parauresis, which is a problem sometimes for athletes. We'll kind of talk about that. Some light intensity exercise might be beneficial. Sometimes, and then in those cases, the AT may escort the individual to like a piece of exercise equipment. And then after the athlete has produced a specimen, the AT will accompany them from the restroom to the specimen collection area to ensure there's no opportunity to put a masking agent in the specimen. So those are some things that the athletic trainer will kind of do to assist with the process. So I mentioned parauresis, which is sometimes problematic. So this is discomfort with being observed during urination. They'll also call it a shy bladder or a bashful bladder. It is actually a social anxiety disorder per the Diagnostic and Statistical Manual of Mental Disorders. So it is a social anxiety disorder and is a distinct thing. And again, it's again, there's basically when normal physiology is impaired without a physical cause, and many times this is associated with depression, poor quality of life. So again, things will be there. You could again there are certain things that can be done. We had talked about light exercise is sometimes beneficial to kind of help further facilitate this, but this is something that the athletic trainer will kind of be there to sort of assist an individual with should they have trouble with it. So just to discuss some laboratory testing procedures. So, as an athletic trainer, you should have knowledge of the process. You're not going to be responsible for analyzing specimens and trying to figure out what people are testing positive for, but you should be aware of exactly what goes on. So essentially the way it works, so the enzyme multiplied immunoassay technique is basically going to be the screen, and they call it the A sample. And what this basically does is it tests to see if a substance is present. So it doesn't give any indication of how much of the drug is in their system. It's just showing that they've been exposed to the drug. So, there are certain instances where then we want to possibly do a more detailed screening. So in a lot of instances, when a person has a positive A sample, there's going to be a more detailed confirmation test to make sure that they have a certain amount of the substance or exactly what type of exposure to the substance they've had. So the next level, or what we would call the B sample, is the gas chromatograph mass spectrometer screening. So that can actually identify small quantities of a substance to confirm the presence of the specific drug. And what basically does here is, so you're doing a test to confirm an A sample, and this also is used to detect. This is generally used to detect anabolic steroids. So we're doing this particular testing for those two purposes. Now the issue with the B sample is it is a little bit more time consuming and expensive to conduct. So, but this will be something that will be done to confirm the presence of a drug and to identify for anabolic steroids. Now, as we move on, so there's some unique things here with some particular substances. So marijuana, And again, where marijuana has evolved is again, with a lot of states legalizing both recreational and medicinal use of marijuana, and that's still even continuing to this day. Medical legal use can still test positive. Now, the NCAA has kind of changed as far as, so in other words, they rely on a quantitative test rather than a simple positive test. So at least as of the writing of the book, July 2019, they basically look at a positive marijuana test as being greater than equal to 35 nanograms per milliliter. So, and again, they're particularly looking for THC. Again, CBD products also, though, do, can possibly give a positive test as well. And then we look at anabolic steroids. So something to keep in mind is that the endogenous steroids can also affect the testosterone to epitestosterone ratio. So basically, the way this gets looked at, so a normal testosterone to epitestosterone ratio is 1 to 1. They consider a positive test a 4 to 1 ratio, again, because of the fact endogenous steroid, again, different individuals can have different levels of this, different levels of the endogenous steroids in their body. And then basically, if an individual does have whatever constitutes a positive test, uh, drug-free sport will then contact the institution in the case that there is a positive test. Looking at some ways again, there's a couple reasons again why we talk about drug programs are in place. But again, I guess one of the components you do look at is again the philosophy is to maintain the integrity of the game, particularly when you're looking at performance enhancing drugs and what individuals are taking. So, and again, individuals will try to beat tests, and partially because again just getting a positive drug test can have it could be damaging to their reputation, and there could be other issues associated with that. So they do try to cheat in order to pass tests, and there's various ways you can do this. The use of a masking agent is a drug, a device, or some type of thing to basically beat the test. And again, what a lot of masking agents do, particularly for like a lot of the drugs, is basically they affect the renal and urinary system, and affect how when those drugs get excreted. So again, there's a couple things you look to do. So it's used to reduce steroid conjugate excretion. It inhibits urine concentration and inhibits endogenous steroid synthesis. So these are different masking agents that, in ways that people will basically try to beat the different drug tests. So, and basically again, so you're looking at different types of masking agents, and they list some particular masking agents in the chapter. Diuretics will sometimes be utilized here, and what a diuretic will do is actually increase urine volume, which will dilute the urine concentration. Now they do also test for masking agents as well. Finasteride, that's basically which is used to effectively treat prostate enlargement and hair loss in men. Masks nandrolone, which is another steroid. Probenecide is a medication used to treat gout. And that again also will affect urinary excretion of testosterone, epitestosterone, and norandrosterone. So those are some of the masking agents that can get utilized. Ketoconazole is also an antifungal that could also lower that testosterone to epitestosterone level as well. So those are some of your masking agents. There's been media reports on various athletes utilizing different types of more elaborate techniques. So your textbook talks about the Wizinator, which is a prostatic penis that they can store borrowed urine in. That's one thing that has been utilized. Individuals have also used techniques where they will, with a catheter, take their urine out and put another individual's urine physically back into their bladder. Obviously, there's a lot of potential issues with that, but that's basically using borrowed urine in order to do that. There was talks about If you look back at a landmark case with Balco, which was a lab, they came up with an anabolic. They basically came up with designer anabolic steroids, basically that produce a lesser concentration of what would basically be found in a drug test. So there were some specific things that were basically done there. And then there's other issues with like inadvertent prescription drug use. That that does sometimes happen as well, and again, that's why it's always important to make sure that individuals, and that's something where like when when you're working with a team, or particularly a team that competes internationally, to make sure that all of that is kind of taken, all that the issues associated with prescription drug use is taken care of. And then another thing that we look at with this is what they call the athlete biological passport. So at the international competition level, the athlete biological passport is just established by the World Anti-Doping Agency. And what this does is just looks to test biomarkers over time. And it's kind of an indirect testing approach. And this kind of allows a little bit of personalization of tracking results by basically establishing an upper and lower limits of of an athlete's testosterone to epitestosterone ratio over time. So that's another thing that also then kind of ties into a person's natural testosterone epitestosterone levels, and as a way to kind of avoid issues with taking banned substances. So that brings us to looking at therapeutic use exemptions, and this is an important thing. So this basically allows the use of a banned medication, and again, you need to make sure there's extensive documentation. A good example of this is individuals with attention deficit hyperactivity disorder, and they're getting treated with which is basically a restricted use medication, Adderall or Ritalin. There needs to be extensive documentation. The NCAA requires that specific testing be done, and that the individual has all of this documentation. So that's one example. They also acknowledge the when you look at therapeutic use exemption, it's basically acknowledging legitimate purpose of the banned drug. So you have to look at, would the athlete's health be impaired? So these are the things that they look at, and that it's not likely to enhance their performance. So those are kind of like the big things they look at, as far as if someone does file for a therapeutic use exemption, that these are the two things they look at. So again, what is their medical condition? What are they being treated for? And there needs to be, fairly, extensive documentation regarding this. The one thing that they look at is that um, there's no general therapeutic use exemption for testosterone in female athletes. So, and then the reason for that is because the FDA only approves of testosterone for men. Again, they do look at it as an as-needed basis. If you do have a female to male transgender athlete, that they will look at that as needed, regarding the use of testosterone in those circumstances. And again, there's other things that get talked about. Your book does mention about commercially available poppy seeds, that you could actually eat on food. So they actually recommend to avoid those in food, because it can give a positive test for opioids. So within a 24-hour test, and at 48-hour intervals, a person can test positive. If they do happen to eat like poppy seeds on their food, they could test positive for opioids. So they should be kind of, most athletes should avoid food with poppy seeds, during spans where they could be tested, just to potentially avoid a positive test. So again, in summary, so again, we look at these comprehensive drug programs, and again, the idea is, again, that the big take-home point is the safety and health of the athletes is what you look at this. And again, testing has evolved, and again, that's to the point where, as I said, even many institutions are kind of operating with their own testing procedures. We found that positive tests now start to have more extensive sanctions. Again, the one big thing is where athletic trainers can definitely be of assistance with their athletes, is make sure that if they are on a prescription medication, that that gets disclosed, and then obviously if a therapeutic, for instance, if a therapeutic use exemption needs to take place, that the documentation of that is in place. So that's going to be more than appropriate for the athletic trainer to do in that information. So from a paperwork perspective, you need to make sure that that's taken care of. And in the end, the athlete is responsible for what they ingest, and that's another thing that they need to be aware of. So if they are going to take supplements, they do have to be aware, again, that now the National Safe for Sport supplements, obviously there's a degree of safety there that they don't have to worry about. But anything outside of that, they do have to be aware of. Anything they ingest could possibly test positive for substances. And these are your learning objectives.